Muse from the Borderland. This is EPAS Unleashed. Hi everyone, and welcome back to EPAS Unleashed. I'm your host, Jessica Navarro. We do have a very special guest who has taken the time out of his busy schedule to join us for February, which is our National Prevent a Litter Month or Spay or Neuter Awareness Month. So thank you so much, Dr. Chacon, for joining us.
Thank you for having me.
Yes, thank you. And we are going to be talking about, like I said, National Prevent a Litter Month. We're going to go over the benefits of spaying and neutering, whether health or behavior, and then we're going to answer some misconceptions that we find a lot here in El Paso and elsewhere. So first off, let's go ahead and get into a little intro about you, why you started working for us, where you worked before.
Yeah. Okay. So short story is I was born here in El Paso,
Awesome.
and then raised in Anthony, went to NMSU, then went to the UK, lived in London for quite a long time.
Oh, wow.
Studied at the Royal Veterinary College. Came back here just recently, so I was there for about 13 years. Came back recently, took a bit of time off, and then started working again. So in terms of finding you guys, I was wanting to work something a bit different from private practice, which is what I did for 8 years. And I had contacted the Humane Society actually next door and see if they needed any vets. But they led me to you guys. And then the next day, I had an interview with Terry, and he just gave me the rundown of, what the situation is and how things are run and what our goals are. So I felt like I could really make a greater impact, I suppose, doing this compared to private practice, which I still enjoy, but I kind of wanted something different, and they were offering that, and I could really get into what goes on here. So
Yeah, we definitely jumped on that opportunity because we were without a vet for quite some time.
Next day. Next day.
Yeah, we wanted
I think I was in the
get you in here as
I was
quick
watching
as
a movie.
possible.
I was watching I was at the cinema watching a film, and then I had to go out there to answer his call. So
yeah. And can you talk a little bit about the difference between private practice versus what you're doing now with us?
I mean, it's a big difference. I think private practice, you use a certain set of skills that you may not use in shelter medicine, and shelter medicine is kind of use more surgery skills than you do in private practice. I do a lot more surgeries here. It's more about population medicine rather than individual cases. But there is definitely a mixture between the two, and I will speak with private practice vets about certain cases, but it's quite a different path, I suppose. Yeah.
And have you always wanted to be a vet? Was this something that you grew up?
I think so. I think I've always been exposed to animals growing up. We always had stray animals coming through. For me, it started with a little pregnant stray cat. She had quite a few kittens that I ended up raising, and I think that's sort of where it probably started. And then from then on out, I just sort of stuck with it, and then here we are. So
Well, we're glad that you stuck it out, and now you're with us because you're doing a really great job here, and you are changing a lot of things here, and we really appreciate it. Can you speak a little bit about the difference between the UK versus here in the States?
I think in terms of diseases, so the UK is rabies free. So we only vaccinate against rabies when they're traveling abroad. Here, obviously, we vaccinate all animals that leave the shelter. And distemper is also a big one. Distemper is very rare in the UK. I don't think I ever saw a case of distemper, and obviously here it's a lot more prevalent, and it's one of the main diseases we fight here at the shelter. So those are sort of the issues. Also heartworm. Heartworm's not very prevalent in the UK, and it is here. So that's kind of the main differences.
The main difference
Yeah.
is what you're saying. Yeah, and that distemper, it's really, really ugly.
Yeah, it's very ugly. So that's why we always say, vaccinate. You know, everything needs to be vaccinated because these are all preventable.
Yes. Yeah. Yes. And on that note, vaccination is very, very important, but spaying and neutering is also something that is huge, especially here in El Paso. Yeah. I'm sure that you can tell that we have just an overpopulation problem here in El Paso.
Yeah. I think with the spay and neutering, you know, I'm trying to do my part, but I'm only one vet, you know, and we need other vets to sort of come and join our team and help spay and neuter all these animals. In terms of the public, spay and neutering is probably the most beneficial thing you can do to help with all this overpopulation that we've got at the moment. Currently, we've got a lot of dogs, way too many dogs, especially for this time of the year. Usually it sort of has a little uptick in the summers, but this time of the year it is a very large amount, and I'm seeing way too many animals, especially older animals that haven't been spayed or neutered. Yeah. So get that done at an early age. Yeah.
Yeah, and as far as spaying and neutering, is it better to do it when they're younger ages, or should they wait?
So there's a lot of it's most beneficial when they're younger. So in terms of the ideal age, it can range depending on which vet you speak to. Yeah. So typically I do them at 3 months of age, but we always try to aim before their first season because obviously we don't want them becoming pregnant, but also health benefits of spaying them before the first season is that they have a less chance of developing mammary tumors later on in life if you do it before the first season. Yes. So, and the risk of anesthetic is lower when they're young and healthy. So that's sort of the ideal time. Yeah.
Yeah, and as far as health benefits, you're speaking on females and males. There are also health benefits when.
Yeah, absolutely. So in terms of males, so if we think about it logically, if we remove the testicles, then they can't develop testicular tumors. So that sort of helps with that. It also helps with the prostate. So the prostate enlarges as they get older when they're intact. So if we remove those hormones, it reduces in size, and that prevents issues urinating, infections in the prostate, things like that. But also, we find that if they're neutered, they travel a lot less. So if they're traveling a lot less, they have less chances of being in an accident, hit by a car, things like that. So, and statistically, animals that are neutered live longer.
Yeah. So if somebody wants, the best for their pets, for their health, then you would definitely recommend spaying and neutering at a young age. Yes. Okay. And as far as we kind of went over that health benefits, behavior benefits, like you said, dogs are less likely to roam if they are neutered. Marking is also something that we do hear a lot about for males, both cats and dogs.
Absolutely, that can be quite. When I was in private practice, I would see a lot of clients that had issues with cats urinating in their house, and the whole house smelled like urine. Yes. And you can't really prevent that unless you neuter them. So that's sort of in terms of behavior, less male-to-male aggression, less competing, less fighting.
So we spoke a little bit about the overpopulation problem. You mentioned, in the summer, we do see a higher influx of, pets coming in. So litter season is coming. We definitely want to get this out to the public to, spay and neuter before that hits us because we are, like you said, already flooded with animals.
Yes.
So we would love for, the community to really think about the pets that are here and spay and neuter. That way we don't get that influx.
Yeah, so especially sort of with the coming season, that's when we start to see the litter season come with cats.
Yes.
So cats basically are induced ovulators, so that means that they'll repeatedly come into season until they're mated, and their season sort of lasts for quite a few months, starting sometime now, and goes until fall. So that's when we start to get the uptick in litters during the summer. So this is sort of in terms of dogs. Dogs don't really have a litter season. They kind of just come into season, depending on the breed, once or twice a year.
Okay.
And or maybe even 3 times. But yeah.
And how young can cats start reproducing?
At a pretty young age. I mean, it can vary. So it'll be, it can range between 4 to 6 months, probably average 5 months.
Okay.
But I've seen some come into season a lot earlier. So yeah, it's best to get them done.
So as young as 4 months, they can start reproducing. So definitely, just because they're a kitten does not mean that they're
correct.
They're not gonna go into heat or anything like that. And as far as like post-surgical instructions, is there anything that somebody would need to know to do before, or like any research that they should do in terms of spaying and neutering before?
Before. So I guess in terms of the surgery itself, like what they need to sort of...
just like what they would prepare for like spaying and neutering. What should they like look into? What should they research and stuff like that? What should they expect?
Yeah, I think sort of with your own personal dog, I think it depends on the breed. Okay. So larger breed dogs, if you spay or neuter them a bit too early, they can have joint issues later on in life. Okay. Dachshunds can be a bit more prone to back issues. So I think it depends on a breed to breed basis. But for most animals, it's pretty standard in terms of when you should do it. So.
So definitely reach out to their vet and consult with them and see what would be best for their pet. Yeah. But definitely spay and neuter. Yeah. And then post-surgical instructions. What are some things that we do here for like post-surgical instructions? Yeah, so I think sort of the main thing is to restrict their movement, because we do make an incision, and we don't want them running around, bursting the incisions or anything like that. So proper wound care. So you just need to look at the incision site, check if it's red, inflamed, if there's any discharge, if there's any swelling, just sort of keep an eye on it, make sure it all looks nice and healthy. And then if there's any issues, you just contact us or contact your vet, and they'll be able to. Most vets do sort of a 3-day post-op check anyways, just to make sure everything is healing as it should. But restrict their exercise, a bland diet, boiled chicken and rice, because the anesthetic will make their stomach a bit sensitive. So it's always good to help sort of prevent any kind of vomiting. In terms of before the surgery, we don't want them eating. Usually it's sort of 8 hours. We starve them 8 to 12 hours or so, because with the anesthetic, what we do is when they go to sleep, we don't want them vomiting up, because if they vomit something up, then it can go down the wrong pipe, and that can cause a lot of issues. So that's sort of the key in terms of before the surgery. Okay. Yeah. Perfect. So now we're gonna look at some misconceptions that I found online in regards to spaying and neutering. So let's see here. Okay, so this is a good one. My pets are siblings. They won't mate.
They don't care.
They don't care.
They don't care. When the hormones are raging, they will find someone of the opposite sex. Yeah. So even if they're raised together, it's not going to make a difference at all. They will become pregnant regardless. Yeah.
And just to backtrack a little bit, you said, kitten season is pretty much coming. If a litter is taken from their mama, does the mama go back into heat?
She'll go back into heat pretty quickly. If it's still sort of in the season, once things calm down in her system, she'll pop back in. Yeah.
Okay, so then definitely do not kidnap during the season because it's just going to bring even more kittens in. Okay, so spaying and neutering is not safe.
I would say there's not safe is not the right way to put it. Mm-hmm. There's always a risk. Yes. Especially with the anesthetic. There's always a very small risk, but it is a small risk. Just like humans, we have to accept that risk to to do what we need to do. In dogs and cats, it is a very low risk. It does increase as they get a bit older in terms of elderly, when they're sort of 10 years and above. Yeah. But otherwise, overall, still very low risk.
Minimal risk. Okay. My pet is too young to get pregnant. I kind of already touched on that.
Yeah. So I think people underestimate how quickly or how young they can be.
Yeah. Pregnant, yeah. And like you're saying, I mean, there's so many health benefits, and, getting that done as early as possible. Of course, again, consulting with their own personal vet. But it's going to have so many health benefits for their pet in the long run.
Absolutely.
Okay. My pet is special. I want a puppy or kitten exactly like her.
Yeah. I mean, all pets are special, right?
Exactly.
But we've got plenty of animals here at the shelter with all different kinds of personalities. So you're definitely going to find one animal to fit what you want and your needs. Yeah. Absolutely.
Exactly. I can find the litter homes.
You can, but it's difficult.
Yeah.
It's very difficult. When I was a student, actually, I found when I was at NMSU, I found a litter, and finding those homes took a lot of work, a lot of work. Yeah. So if somebody thinks that, they can just breed their dog or cat and be able to sell those animals or find them homes, it's a lot of work, honestly.
Yeah, and it's a lot of work too when they're babies and caring for them, and it can be expensive as well.
It can be very expensive, and it can be very time consuming. So
and I mean, we have so many animals here, and it's hard for us to find these animals homes. And they have a microchip. They have their vaccines. They are spayed and neutered.
Yeah.
And we're still having trouble finding.
Yeah.
So I would definitely. Like you said, you can find the litter home, but it is going to take a lot of time and effort. And why not just adopt?
Exactly.
Okay, female dogs and cats should have at least one litter before having them spayed.
This goes back to sort of the health benefits of doing it before they have a first litter, which is the health benefits of reducing the risk of mammary tumors. I think a lot of people put the way they put a lot of human emotions onto animals. Yes. They say, I want my cat or dog to feel like a mom, or I don't want my boy dog neutered because I want him to feel like a man, like macho. But we have to kind of not do that and not put human emotions on animals because they don't think that way. Yeah. So I think we need to get away from that kind of thinking.
Yeah, they definitely don't have the same, like you said, thinking as humans do. I mean, I'm pretty sure my dog doesn't care about being a mom the same way that, I would or someone else would.
Yeah.
It's a completely different mindset being, a pet. So, spaying and neutering will cause my pets to gain weight.
I would say spaying and neutering affects their hormones, okay? And they may be, they can more easily gain weight. But you can easily counteract that by adjusting their diet.
Yes.
Yeah. So they do. I know a lot of diets have, or a lot of dog or cat food has sort of different stages of their life. So stages for before they're neutered and after they're neutered. So as long as you give the appropriate food, then they won't gain weight. So you just have to be aware of that idea, and they'll be fine.
Spaying and neutering is unhealthy for pets. So, again,
I think
just to reiterate, I mean, we see that there's just so many health benefits,
yep.
behavior benefits, that it's definitely not unhealthy. Neutering will make my pet feel less of a male. So, again, we touched on that, you know, like you were saying.
Yeah.
Pretty sure a male dog doesn't want to be a macho man like people are claiming.
Yeah.
Okay. Neutering will cause behavior changes.
Yeah, I think people are worried that there'll be behavioral changes to them, that the way they act to them. The behavioral changes will be to other animals, like we said, male to male aggression, but the way the animal acts towards you and your interaction, human to animal, will not change. So it's not, I think a lot of people just think their animal's going to be a completely different animal, but in reality, they're going to be the same animal, just a bit more calm with others.
Yeah. And again, health benefits, you know, they're probably going to live a little bit longer if you do the spay and neuter. So in reality, it's just something that is going to benefit them at the end of the day. And if you said they're not going to change the way that they feel towards me, why not, you know, help them live a little longer? Indoor pets don't need to be fixed.
I would argue that they probably need to be fixed more than any other animal, because when they're indoor, if they do get out, right? Like if you have a cat during the season, they're going to want to get out. They're going to find any way to get out. Obviously, they don't know their surroundings. They've been indoor for, you know, most of their life. You know, they could get lost. They could get hit by a car. So it's all sort of strange surroundings to them because they want to go and mate. So I think that's a pretty strong argument to actually neuter them, especially if they are strictly indoors, because you never know that time that you accidentally left the door open and then out they go.
Yeah, and that's definitely one that I hear a lot is, you know, my pet's indoors, they're safe, they don't go outside, they're not going to come in contact with, you know, another animal. But like you're saying, if they escape, they definitely don't know anything about being outdoors, and they're just going to, you know, go crazy out there and potentially get hit by a car, you know, get lost, and it's just something that even inside pets need to get done.
Absolutely.
Okay, my pet is too young to be spayed or neutered. So you kind of touched on that already. You said as young as 3 months that you do the
I do it 3 months. There's some vets that even do it a bit earlier at 2 months, but my preference is 3.
It's 3 months. Okay. Spaying and neutering is very painful for my dog or cat.
So a surgery is painful. Obviously, they don't feel any pain when they're under because they're under anesthetic. They're unconscious. They don't feel any pain then. So the worry about pain is afterwards. But we do provide pain relief. We give a pain relief injection during the surgery or when they're prepping. And then we use local anesthetics as well to provide additional pain relief. And then they go home with added pain relief. So, you know, obviously, each animal is on an individual basis. Some have a higher or lower pain tolerance, and we can sort of adjust what we need to in terms of making them as comfortable as possible.
And usually within a couple days, they're, you know, back doing...
Yeah, I mean, they're sort of back. You know, we don't want them doing what they normally do in a few days.
Yeah.
You know, we want them to rest for about 1 to 2 weeks or so. But the animal themselves usually will feel like themselves sometimes the day after.
Yeah.
So It depends on them, but usually they're up and about and back to their normal self.
Oh yeah, when I used to be with our adoption foster team, there was this one dog who just got out of surgery and was just trying to, jump on me, just so excited, like nothing even happened.
Exactly.
So.
Yeah.
Okay, my pet is too old to be fixed.
We don't have an age restriction when we spay or neuter them. We do understand that there is a higher risk when they're elderly, but we take those needed precautions to make sure that it is as safe as possible. So yeah, there's a little bit of a higher risk, but otherwise, we do what we need to do to make sure that they do fine.
I want my children to see or raise puppies or kittens just born.
I mean, it's always cute to, play with puppies and kittens and things like that. But I would argue that an alternative is to maybe foster our, many puppies and kittens that we have here. So that's one way to, help, your kids see sort of these lovely cats and kittens, but are puppies and kittens. But
definitely fostering is a great option if they do want their children to see, kittens and puppies that maybe were just born or what have you. But fostering is completely free here with us. I've seen so many bottle babies, both puppies and kittens, so I'm sure that we can find something here.
Definitely.
Also, I mean, I'm a mother myself, and I know that if my child was asking me, wanting to see puppies or kittens just born from, our pet or whatever, I would, bring my kid here to the shelter and see all of the pets here that are looking for their homes, and, just explain to them how overpopulation here in El Paso, it's not going to, be helped by having another litter brought into already overpopulated community. So, okay. It's too expensive. So I know that it can be, a little bit pricey, just depending on what vet you go to. Me personally, when my dog, when I got her spayed, it was about $400. But I was a waitress, so if I can do it on a waitress salary, it is going to take some budgeting. We also have a lot of resources. Our mobile pet vet, that's a great way for a low cost option. And epvma.org is definitely a good resource that we use here.
I think that was the cat in the back jumping around. So
yes.
That was.
So epvma.org is a great resource that we definitely share here with the community to research on different options that they have, different vets in El Paso that they can visit to get that procedure done. So
yep.
Okay. Is there anything else that you would like to add about spaying and neutering?
Just to get it done. That's all.
Please help us.
That's all we're asking. Is that's in terms of doing your part, we just ask two things: that you vaccinate your animal, and that you spay or neuter them. That's sort of the main things we're asking, because overpopulation is such a huge issue, and we need the public to be with us, and I think that's sort of the main takeaway.
Mm-hmm. Yeah, we definitely need the community's help in stopping this issue. Before we close out, did you notice a difference between being in the UK versus here in terms of overpopulation? Did they have that issue?
I mean, I think everywhere has that issue. I honestly didn't see it too much in London. I think, it wasn't a prevalent thing. But also, I wasn't in shelter medicine at that time, so I was mainly dealing with private practice things. So. But it's when I got here, it was I want to say it was a bit of a shock, but it opened my eyes to see sort of the issues that we have here in El Paso and what we need to do to sort of turn things around. And we just want a nice, healthy pet population. That's all we're asking.
Yeah, I definitely had the same eye-opening experience when my pet went missing and I came here. Just seeing all the pets here, it was just so crazy. I could not believe how many homeless pets that were here at the shelter, and so many beautiful pets. There are so many beautiful pets, so many great dogs here and cats that are looking for their home. And again, why bring more litters in when we have so many great dogs here available for adoption? So if you don't have anything else to say, then I just want to thank you so much for joining us. I know that you have a really busy schedule helping all the animals here, and we appreciate you again. And we thank you so much for joining our team. We're glad to have you.
Appreciate it. Thank you.
Thank you. So that's it for our episode. We hope that you enjoyed. Like, comment, subscribe, and we'll see you next time.